Assalamualaikum warahmatullahi wabarakatuh. Hello all. I want to introduce myself. My name is Nur Hikmah Anwar. You can call me Nur. I am currently a student in Polytechnic Karya Husada. I will make presentation about acute respiratory infection in children. Definition of acute respiratory infection. ARI is a disease that occurs due to infection in the upper respiratory tract. These channels include the nose, nasal cavity and sinuses, throat or pharynx, and the vocal cord box or larynx. ARI can appear suddenly and can be experienced by anyone, especially children. Cause of ARI in children that need caution. The main causes of ARI are viral infections such as rhinovirus, adenovirus, Coxsackie virus, parainfluenza, and RSV. Virus and bacteria that cause ARI can spread in several ways. For example, when a child inhales a spark from someone who has an ARI, spread can also occur when children hold objects that have been contaminated with virus or germs that cause ARI and are completely unaware of the infection or their own mouth. ARI symptoms in children. When experiencing ARI, children can experience symptoms or complaints in the front arm, nasal congestion or runny nose, sneezing, cold, sore throat until hoarseness, the eye hurt, runny and redness, headache, muscle ache, fever, pain when swollen. The problem of acute respiratory infection in children is getting worse, although it can improve on its own. ARI in children needs to watch out for if getting progressively worse or accompanied by the following symptoms: hard to breathe, breath sounds, pain in the chest or abdomen, convulsions, loss of consciousness, lips and nail appear bulls, the skin becomes pale and feels cold, indigestion such as nausea, vomiting, and diarrhea. If there are several symptoms above, it could be that ARI in children has caused more severe complications such as dehydration, pneumonia, and bronchitis. These conditions need to be treated by a doctor immediately. Treatment and prevention of ARI in children. 1. Give the child enough to eat and drink. When exposed to ARI, children will become less willing to eat and drink. This can cause it to become dehydrated. Therefore, try to give the child enough water to prevent dehydration. Water can also help thin the phalange, so that the respiratory tract feels more relief. If the child does not want to drink water, try giving other options, such as lemon water and warm tea mixed with honey. But remember, honey should not be given to children under 1 year because of the risk of botulism poisoning. When sick, children also need enough energy, so make sure the child eats regularly. If he cannot finish eating normally, give the child less but more often. If necessary, provide multivitamin supplements according to the doctor's recommendation so that the child's nutritional needs are met. 2. Make sure the child gets enough rest. Children who are sick need to get enough rest, at least 9 to 10 hours every night. To help children rest comfortably, try to create a comfortable and clean atmosphere in their bedroom. You can read a storybook and hug the child until he falls asleep. When he feels uncomfortable, Do not forget to clean the child's room for cigarette smokes, dust, and dirt. If necessary, you can use a humidifier to keep the air clean so your child can rest comfortably. 3. Try gargling salt water. When being exposed to ARI, the child will feel a cold and short throat. These complaints can be overcome by gargling warm salt water. The trick is to mix a glass of warm water with 2 teaspoons of salt and dissolve it. After that, ask the child to gargle with salt water and then melt. Although effective enough to relieve the symptoms of ARI in children, this method should only be done on children ages over 8 years. 4. Use medicine. If the child's condition has not improved, you can provide medicines to help relieve the symptoms of ARI. This drug can contain paracetamol to relieve fever and pain, cough medicines, and decongestants to treat colds. But before giving the drug, you must read the instructions for use and the doses of administration according to the package. So the children do not frequently replace ARI. Take the following steps to replace ARI. A. Avoid direct contact with people who are sick. Remind children to wash their hands regularly, especially after doing activities outside the house, changing dirty clothes, after urinating too large, and before eating. B. Teach children to always close the nose when coughing and sneezing. Avoid sharing toys, cutlery, or towels with other people who are sick. C. Routinely cleaning the house and objects in the child's bedroom, such as bed linen, blankets, and toys. Complete child immunization. D. ARI in children can indeed be restored by itself, needed if the child's immune system is good. However, if the symptoms do not improve after a few days or vice versa gets worse, immediately consult a child to the doctor. Likewise, with children who dispute the fact that need to be watched out as has been questioned about, immediately bring the child to the doctor to get the right help. And conclusion. The conclusion is that a respiratory infection is an acute infection that attacks one or more parts of the respiratory tract starting from the alveoli, such as the sinus, middle ear cavity, and pleura. Respiratory tract infection acute disease is also a very important disease that is very often encountered in children. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh. Bye.